My name is Mrs. Olaiwola. You are welcome back from your break. This semester, I'll be taking you NSC 402, Maternal and Child Health 2, which is the condition of the previous semester. Introduction. The aim of this lecture for today is to just create an awareness and introduce NSC 402 to you and talk about the content, the objective, the evaluation review, and all sorts. So, introduction. The aim of this course is to prepare professionally competent and versatile midwifery practitioners that can provide high quality of care to individuals and families in home, community, health centers, hospitals, clinic in the rural and urban center for society, with emphasis on reproductive function. Students offering this course will learn about the process of childbearing, with attention given to the structure, functions of family in the maternity cycle, and responsibility and competencies expected of the professional midwife in the course of care delivery. So during this course, be able to assess the need of the family in the reproductive life cycle, with special references to basic need of individual along with their developmental stages. Also, to utilize the nursing process in providing comprehensive nursing and midwifery service to individual and group in the community. Also, to provide antenatal care, intranatal care, postnatal care services to family in the maternity cycle, and manage minor disorders during antenatal, labor, postnatal period of their childbearing age. Also to practice and maintain safe and clean delivery services. Also, to be able to function independently and in collaboration with other members of the health team in the hospitals, clinic, the community, and the traditional birth attendants to provide comprehensive maternal and child health services. And lastly, to effectively organize and manage clinic to achieve the goal of health maintenance by utilizing available human and material resources. Objective of this course. So in NSC 402, at the end of this semester, as a student, you should be able to discuss community practice that affects maternal and child health. You know, we have different community cultural practice that are beneficial, and some are hazardous to both the mother and the child. So during this course, you should be able to discuss them with ease, and also to describe counseling and communication strategy for relevances in maternal and child health services. And also, you should be able to demonstrate the knowledge of care of newborn. At the end of this course, you'll be able to discuss strategies and measures to reduce maternal and child mortality in the community and also in Nigeria as a whole. You should be able to participate in domiciliary practice and family care as necessary. At the end of this semester, you should be able to participate in maternal and child health service program. Example, during immunization, growth monitoring, oral radiation therapy, how to prepare it and how to go about it, as the case may be. Also, the content continue during this course. We have to talk about community cultural practice. We'll be talking about maternal and child health nursing practice in the community setting. How do we practice MCH in the community setting as a whole? We will also review the reproductive system in relation to the practice of normal midwifery. All your knowledge of normal anatomy that you have had and physiology before, we're able to just do a paraphrase and review the reproductive system, both male and female reproductive system. And also, we'll talk about the health of the family, the normal need of mother, father, the fetus, and other siblings in the family. And in this context, we'll talk about the acceptability and adaptability to the pregnancy for the mother, the father, the siblings, and also the baby in utero. And also, we'll be talking on the management of normal pregnancy. As a midwife, how do we manage normal pregnancy? How do we manage labor? And also, how do we manage the patients during prepucium and also the care of baby? The content still continue. We'll also talk about immunization. We'll talk extensively on expanded program on immunization and also national program on immunization. Also talk about oral radiation therapy. We'll be talking about physical assessments, how to make nursing diagnosis, a standing order, and how to implement nursing intervention. So we'll also talk about physiological assessment of newborn and also neurological assessment of newborn. This course, NSC 402, will be talking about family planning services and postnatal exercise. You can see this box showing the different type of family planning method that we have. We have the natural method, which is the type of female condom and male condom. We have the hormonal method where we have the pills and also hormonal ring. We also have the barrier method, the chemical barrier. And in that, you can see a cross like that. This is what we usually call copper T. And also we have implants. We also talk about natural family planning method, where we'll be talking about coitus interrupters, calendar reading method, basal body temperature, also patch, and so on. Also, we'll be talking about infertility. The meaning of infertility, the types of infertility, what are the risk factors, what are the causes, and also the management of infertility. And we'll be also talking extensively on the ART of infertility, the artificial treatment of infertility. Also, we'll be talking about data collection. As a midwife, we'll be able to collect a comprehensive information and patient data. And also, in management of family planning, management information is very, very important to manage the flow of information and how to use commodity, how those commodity that is being supplied is being used. So to give the feedback to the supplier and also to the hospital management. Also, we talk about record keeping. In this, how to keep adequate record in the community practice. So the teaching strategy that we are going to be using this semester, number one, we'll be using our usual lectures method. So we'll be using our case study. Go to the word and pick case study to be presented, and also group discussions. The practical aspects will be done with patient simulations, and also our online modules and interactive resources. And evaluation, how do we assess you this semester? Our assessment will be based on both formative and summative assessments, where we'll be talking about the quizzes and examination. Also, we'll talk about case studies analysis, group presentations, written assignments, and also reflection from the class. And lastly, we're talking about clinical practical. So all these five will be analyzed and graded together, and that will be your total score at the end of this semester. So I wish you a peaceful semester, and this semester is bulky, so we are ready to face the challenge. And I hope it will be interesting and you're going to enjoy the course as a whole. Thank you. See you next class. Bye.